I would first ask you to sit back and get comfortable because we're going to be here for a while. Because we're going to be talking about one of the most important issues that face this Commonwealth today, and that is the health care of our people. There is a time for campaigning, and then there is a time for governing. Today, some 10 days after the November election, it is time for us as a state to turn our back on politics and turn our attention to identifying the health strategy that is best for our families and for our businesses. The campaign was filled with strident talk centered on Kentucky's bold steps to improve the health of its people. And that's natural. During election season, the political rhetoric tends to be strong and the promises bold. But the fun and games are over, and it is time to get serious. It's time to sit back, take off our partisan glasses, and discuss a sophisticated, analytical problem that we have and a way to solve that problem on how best Kentucky can continue to improve the lives of our people and build a stronger workforce. Over the last 8 years, I have partnered with leaders of both parties and in both the public and private sectors to lead Kentucky out of a recession and to begin addressing in an aggressive way fundamental weaknesses that have held us back for generations. And the most stubborn of those weaknesses, poor health. We all know that Kentucky's collective health has long been terrible. In almost every measure there is, we've ranked near the bottom or at the bottom. The suffering is deep. Kentuckians are sicker than most. We die too early, and our families go bankrupt paying to treat diseases and chronic conditions. For our state as a whole, our poor health has had terrible consequences. There is a direct line between poor health and almost every challenge that Kentucky faces, whether that's poverty, unemployment, lags in education attainment, substance abuse, or crimes. Creation of a state-run health benefit exchange called Kynect, wider access to substance abuse and behavioral health treatment, and a multi-pronged initiative called kyhealthnow that has attacked long-standing health problems like obesity, smoking, dental decay, and heart disease. Now, in a few minutes, Lieutenant Governor Crit Llewellyn, who is up here with me today, will come to this mic and talk about our last progress report from Kentucky Health Now, which she chairs. But I want to first put that information that you will hear into perspective. It's critical to recognize that Kentucky Health Now and the other initiatives that I mentioned collectively represent a fundamental overhaul of core elements like how people access care, how that health care is delivered, who can access that care, and what services they'll receive. Folks, this has been reform with a capital R. Now, one of the biggest reasons for our poor health has been a lack of access to health coverage. When we started, an estimated 640,000 people in Kentucky were uninsured. That was almost 1 out of every 6 Kentuckians. Lack of health coverage was jeopardizing their health and their financial security. They got up every day and rolled the dice and just prayed that they didn't get sick. They chose between food and medicine. They ignored checkups that would catch serious conditions early. They put off doctor's appointments, hoping a lump or a pain turned out to be nothing. And they lived knowing that bankruptcy was just one bad diagnosis away. Furthermore, their children were going long periods without checkups that focused on immunizations, preventive care, vision, and hearing tests. Things like diabetes, asthma, or infected gums were going undiagnosed and untreated. Now, some critics act like these folks are from some distant planet, but they're not. They're Kentuckians. They're our friends and neighbors. They're our former classmates. They're our hunting buddies. They're the farmer on the tractor, the substitute teacher grading papers, the seasonal construction laborer, the nurse's aide, the new graduate at a new high-tech startup, the grocery clerk. We sit in the pews with them on Sunday. We sit in the bleachers with them on Friday nights at the high school games. Many of them have jobs, but their employer either doesn't offer insurance or it's priced out of reach. So they and their families were left out in the cold. We set out to change that by expanding Medicaid eligibility to 138% of the federal poverty level, and by creating Kynect, the state-based portal through which private insurance is available. Together, these decisions have helped over 500,000 Kentuckians access health coverage. Consequently, at least 3 separate studies say Kentucky has been either one of the leaders or the leader among the states in cutting our uninsured rate. Look at the poster on my far right, the map of all the counties in Kentucky, and the radical difference in color between them. And you know, something dramatic has been going on. The map at the top, I believe it's at the top, right, shows uninsured rates before the ACA. There's a lot of maroon, which means more than 20% uninsured. A lot of red, which represents 17% to 20% uninsured. And a lot of gold, which is 14% to 17% uninsured. Then look what happens on the bottom map. As of the summer of this year, those 3 colors have disappeared. In fact, 118 of 120 counties are shaded dark blue or medium blue. They represent 5% to 8% uninsured and less than 5% uninsured. Beneath every change in color are hundreds of stories of Kentuckians and their families who suddenly can afford better health. But it goes a lot deeper. Whether you like the Affordable Care Act or not, every person in this state has benefited from the protections the ACA has given. Whether it's because of the ban on insurance companies denying coverage because of pre-existing conditions, or because kids can now stay on their parents' plans until they're 26 years old, or insurance plans now actually cover the things people need, like cancer screenings and other preventive services, or because there are no longer lifetime limits on coverage, or the subsidies that make health care affordable, or expanded Medicaid. I don't just think those things, I know them. I can't tell you how many Kentuckians have come up to me and thanked me for this life-changing and life-saving program. They are accessing preventive care, screenings, and health checkups at unprecedented levels. That saves money, and folks, that saves lives. They have hope and opportunity for good health for the first time in their lives. Like I said earlier, Lieutenant Governor Llewellyn will be talking about measurable progress attained through Kentucky Health Now. But the bottom line, improved access to health coverage is helping us chisel away at health problems that have plagued us for generations. Look, there are only two factors on which to judge the health care solutions we've employed in the last 8 years. Number one, are they working? And number two, can we afford them? Well, the answer to the first question is in the Kentucky Health Now progress report and the stories of Kentucky families. And as you will hear and see for yourselves soon, that's yes, they are working. So the answer to the second question, can we afford them? Folks, that answer is just as clear and just as definite, provided you put unsupported opinion and ideology aside and look at facts and figures. So let's do just that. Let's look at the facts and figures, compiled not by politicians, but by health providers, health policy experts, and budget writers. Now, because one of the first duties of a new governor is to put together a 2-year budget, let's go right to the heart of the matter and look at what Medicaid expansion does to our budget in the next cycle. We have a handout. I hope all of you have that now that speaks directly to that issue. It's really quite simple. The cost of expansion to the general fund is $257.3 million over the next 2 years. You see that number right at the top. That's the state match that everybody talks about. That's the negative impact on our general fund. Now, what are the positive impacts? Well, there are three. The first represents general fund savings. Under Medicaid expansion, the federal government began picking up the tab for a lot of services we were already providing, but we were paying for them with general fund money. This includes services related to things like mental health, public health, and substance abuse. And you used to see those line items under our corrections, behavioral health, and QCCT indigent care budgets in our budget. That general fund help totals $265 million. Now, if you get rid of expansion, we'll have to go back and pick up that tab again with general fund money. The second line represents new state revenue created by the growth in the industry. To provide health care to several 100,000 people on expanded Medicaid, the health care industry had to grow. That created jobs, about 12,000 new jobs in the first year alone, and it created the need for goods. Those incomes and those goods were taxed. Experts said the growth in revenue will be $246.8 million. Of course, if we get rid of expansion and those health care customers go away, it all happens in reverse. The industry will contract, and that tax money will go away. The third positive impact on the general fund occurs because of a new source of revenue that we created in the Medicaid program. Our latest contracts with the managed care organizations in our Medicaid program now require them to pay a 1% assessment per year, right, per year. That's $45.7 million. Now, add those three lines together. You see that you get $557.5 million in new revenues for the general fund because of expansion. So what's the total? Well, it's going to cost us $257.3 million more. So subtract that, and you see that Medicaid expansion will create a positive $300.2 million positive impact on the general fund in the coming 2 years. Say otherwise. It not only pays for itself, it pays for $300 million in education or public safety or job creation or some other program where money is needed. And of course, if you look at it the other way, rolling back Medicaid expansion will give us a $300 million hit to the next budget. As far as the bigger picture of health care reform, well, we've studied that too. An independent analysis of Kentucky's first year under Medicaid expansion showed clearly what a good financial deal this is for our economy, both now and long term. In fact, it showed not only that we could afford it, but that we couldn't afford not to do it. The analysis by Deloitte Consulting and the University of Louisville Urban Studies Institute studied actual performance data, not just projections, actual performance data. First full year of implementation of our health benefit exchange and expanded Medicaid. And what did those numbers show? Actual numbers. These numbers are not Governor Beshear's political talking points. They're not my hopes and my dreams. It's real data. And it backed up a similar study that I commissioned in 2013 before we made the decision to expand Medicaid. And if anything, it demonstrated that our 2013 projections weren't rosy enough. For example, actual numbers now, because of Medicaid expansion, more than 12,000 jobs were created in the first year alone. That's undisputed fact. It happened. Furthermore, healthcare providers in Kentucky received at least $1.3 billion in new Medicaid revenues in 2014 as a direct result of expansion. That's undisputed fact. It happened. Through July 2015, that figure climbed from $1.3 billion in new Medicaid revenues to $2.9 billion. That's also undisputed fact. That happened. That's not to mention that providers were on the hook for substantially less uncompensated care. Using first-year figures, actual figures, the updated study then predicted off of those actual figures a $30 billion positive impact on Kentucky's economy over 8 years because of that expansion. Now, that's a prediction, but it's based upon actual numbers from the first full year of operation. And speaking directly to affordability, the report predicted a positive net impact of $820 million over 8 years on state and local governments, even after the state match for Medicaid cost is phased in. I just broke that down for you in detail for the first 2-year budget. So contrary to what people without facts say, the facts show we can afford this. Now, yes, the cost of traditional Medicaid, it's going to go up next year. It happens every year because of inflation, rising cost of services and goods, and similar pressures. And yes, the next budget cycle is going to be tough. It's always tough. Throughout my 2 terms, we had to make tough choices and put off investments in order to balance Kentucky's budget. In fact, we came together 14 different times to balance and rebalance it. That's part of being governor. The good news is that receipts are up. The economy continues its drastic improvement, leaving us better able to meet the needs of Kentucky. We've come a long way in 8 years. So, for the next budget cycle, health care reform is a financial plus. And I want to say yet again that policymakers should revisit periodically the question of Medicaid affordability to see if the benefits outweigh the cost. Right now, they do outweigh the cost. But keep studying it. Look at it every 2 years before you write a budget. That's the prudent thing to do. But my friends, this incoming administration is going to start off in an economic situation that I didn't see in 8 years as governor. We have a better economy right now than we've had in the entire 8 years I've been governor. Revenues will be higher than any time I've been governor. We've balanced this budget every time and found ways to provide for our people, and the incoming administration is in a good position to do exactly the same thing. But let's don't just look at this in a vacuum. You see, those economic impact numbers don't address the societal impact of improved health, the impact on quality of life, our economic capacity, or tangible things like worker productivity, school attendance, or our collective public image. You know, the authors of the report, Deloitte and U of L Urban Studies Institute, they adopted a very conservative view to guide predictions of future cost and health care needs. Their financial models assume that Kentucky's collective health wouldn't improve much, and so they assign no financial value to any improvement. Well, when you hear from Lieutenant Governor Llewellyn in a minute, we're already seeing improvement, lots of it. And I predict to you that will continue if we keep providing affordable health care to our people. And as common sense tells you, there's a huge financial value to improved health, both for our families and for our state. The healthier our workforce is, the greater our ability to attract investment. And the more we improve our health and the more we improve our economy, the less we will need to rely on programs like Medicaid. This is a long-term plan for improving Kentucky. But you won't see it if you're blinded by short-term political ambitions or concerns. You have to have a vision. You have to look into the future. And your top concern has to be Kentucky's families. Now, as far as getting rid of Kynect and moving to the federal health benefit exchange, every single argument that is, every argument that's based on facts and data, recommends against it. When I made the decision to create our own exchange, I did so partly at the urging of both Kentucky's provider community and business organizations. Every group, from the Kentucky Hospital Association to the Kentucky Chamber of Commerce, came together and recommended that Kentucky create and control our own exchange instead of inviting the federal government in to do it for us. Today, their recommendation is even more solid. Why? Because while the federal exchange struggled to get up and running, we created the most successful exchange in this nation, one that has been the model for other states. The positive publicity that followed Kynect's rollout alone was worth millions of dollars to Kentucky. What did it show? It showed Kentucky's innovation. It showed our ingenuity. It's inconceivable to me why, just to make a partisan political statement, Kentucky would want to go backward and become the first state to decommission a successful exchange. Let me tell you what that would entail, folks. First of all, you'll be throwing away the $283 million in federal grants we used to create this model exchange. That money has been spent. What did we get for it? We got the best exchange in the nation. And we were able to bring the color of those maps to the blue that we have today. But you know what else it entails if you abolish Kynect and go to the federal exchange? Kentucky will have to pay at least $23 million in general fund dollars to dismantle it and connect it to the federal exchange. That's $23 million, folks, that needs to be spent on things like education or pensions or whatever other issue you may choose, particularly when we've got an exchange that's working better than any in the nation. What else does it entail? Losing all oversight capability, access to data and knowledge about the operation of the exchange. It entails getting rid of the locally responsive and knowledgeable customer service teams and replacing them with teams hundreds of miles from here who aren't knowledgeable about state-specific policy and procedures and the Kentucky insurance market. It entails adding months of delay and duplication to the process, since consumers would have to be ruled ineligible for Medicaid before they could even apply for a qualified health plan. On our website, you can figure those things out simultaneously. Oh, and even if they do away with our exchange, we'll still have to keep a web portal for Medicaid applicants. So getting rid of Kynect makes no sense, especially when moving to the federal exchange would do absolutely nothing to accelerate Kentucky's momentum in improving the health for our people. I mean, better health is the goal, right? Personally, I believe that Kentucky should control its own destiny and keep the jobs that it has created. So do our providers, and so do our businesses. We designed our exchange and we control it. So why should we pay millions of state tax dollars to give it up, especially when the federal exchange is more expensive? Hey, folks, right now, Kynect's operations are funded by a 1% assessment on health premiums. That charge will increase to 3.5% on the federal exchange, meaning costs will go up not only for providers, but also people who buy health insurance on the exchange. Why do that to our people? Just to make a political statement of opposition to the President of the United States? That makes no sense. Now, what about the health of Kynect itself? Well, critics have brought up the fact that the nonprofit Kentucky Health Cooperative isn't offering insurance in 2016, and somehow that proves that health care reform is unsustainable in Kentucky. That's just totally inaccurate. And they're leaving out the most important information. The co-op's absence next year won't make any difference because we have 7 private companies offering insurance during that cycle. The first year we had Kynect, we had 3 companies in this state. Last year we had 5 companies in this state. That list is growing. We now have 7. Competition works. Consumers have more choices than they've had in decades in Kentucky, and Kynect is healthier than it's ever been. I encourage Governor-elect Bevin and his staff to study this data, and just as importantly, to talk to the people who have been fighting the health care fight for the last 8 years. Talk to our families. Talk to our health care providers. Talk to our businesses. Talk to our advocates. Talk to our policymakers. Now, I know we have a lot of advocates in this room today, and thank you for coming. You've been in the trenches a long time fighting for our families. You see the suffering, and you feel the frustration of a system that historically has gotten in the way of better care. The governor-elect ought to talk to you. He should talk to the Kentucky Chamber of Commerce. He should talk to groups like the Kentucky Hospital Association, the Kentucky Primary Care Association, the Kentucky Dental Association, the Kentucky Voices for Health. And if he does, he'll see that expanded Medicaid and Kynect are not only the smart thing to do, but it's also the right thing to do for Kentucky's people. Look, the core tenet of health care reform is helping families and saving lives. Not vague political theory, but helping people. That's what we've been doing here in Kentucky. It's the moral and the ethical thing to do. And if you want to talk about it in religious terms, it's the Christian thing to do as well. You know John Kasich, governor of Ohio, Republican governor of Ohio, running for president. Governor Kasich pushed hard for Ohio to expand Medicaid, and it did. He was harshly criticized for that support by folks in Ohio, and he continues to get criticism during nationally televised debates and on the campaign trail. But Governor Kasich's not backing down. He believes so passionately that Medicaid expansion is both the smart thing to do and the right thing to do for Ohio that he's got an answer for his critics. Let me give you a quote from Governor Kasich. He says, "You know what I tell them? I said, there's a book. It's got a new part and an old part. They put it together. It's a remarkable book. If you don't have one, I'll buy you one. And it talks about how we treat the poor." So, this incoming administration, talk to Governor Kasich. Or go talk to Governor Rick Snyder in Michigan. Or Governor Brian Sandoval in Nevada. Folks, there are 14 states led by Republican governors who operate under some form of Medicaid expansion. 4 of those governors inherited that decision, but 10 of them actively supported it and applied for it. 3 additional Republican governors are still trying to expand Medicaid in some way. Like me, all of those governors, whether they're Democrats or Republicans, decided that the health of their people was more important than political ideology. At the end of the day, folks, we have to pull important policy decisions out of the vat of corrosive acid called partisan politics. And we all have to answer for how we treat each other. For the health of our families, the future of this state, we cannot throw away the progress we've made and start over, just to make a political point. This is not about President Obama. This is not about Steve Beshear. It's about the people of Kentucky, improving their health, improving a stronger workforce, growing our economy. You don't solve a problem like poor health in 1 term or even in 2 terms. It takes generations. So think about it in this way. If you want to turn a barren field into a forest, you go out and plant seedlings. As those seedlings grow into saplings, you tend to them, you protect them, you nurture them, you fortify them. You don't run out in the fields every 4 or 8 years and cut down your saplings and start over. Because if you do that, you'll never have a forest. Thank you. Now, thank you. Thank you. And now I want to ask Lieutenant Governor Llewellyn to come up and give us some specifics about how these programs are benefiting folks here in the Commonwealth. Lieutenant Governor.
Thank you, Governor Beshear. And thank you to the members of the Kentucky Health Now team. They represent all of the executive branch agencies of state government who've been meeting and working with us, and they are all here today. Also, thank you to the leaders of the advocacy organizations and to the cabinet and the wonderful team there. It's been my honor to chair the Kentucky Health Now initiative since being appointed Lieutenant Governor last year. Kentucky Health Now was created by executive order by the governor in February of 2014, and it serves to track our overall progress towards specific measurable goals in health care, but also serves to engage all of the executive branch in an effort to create a healthier Kentucky. Today, we are releasing the final report of the Beshear administration detailing our progress, and this report will be available to all of you. I want to quickly go through the highlights of the report as it relates to health outcomes. Kentucky's overall health status has not improved in 25 years. But today's report provides indisputable data-driven evidence that Kentucky is finally moving the needle on its most stubborn long-term health challenges, like smoking, obesity, heart disease, and cancer. And regardless of your politics, there's no denying that our collective health is improving. Data also shows that Kentuckians are utilizing their new health care coverage in ways that will affect health outcomes. In calendar year 2014, Medicaid claims data show that usage has more than doubled for preventive dental services, breast cancer screenings, and colorectal cancer screenings. Significant increases in screenings were also seen for cholesterol, cervical cancer, and diabetes, steps that will improve health outcomes in the years to come. The report we're issuing today highlights the status of 7 bold goals for the health of Kentucky and the strategies to reach them. This chart, the one closest to me here on my right, is a scorecard that is in the report, and it summarizes the progress toward the 7 goals of Kentucky Health Now that we detail in the report. While the most significant step forward has been providing access to health care for hundreds of thousands of Kentuckians, this report details 60 strategies that have been undertaken to help meet those goals. They range from reducing the number of uninsured to creating trail towns across Kentucky and bicycle paths, to making school campuses tobacco-free, a wide-ranging approach that has impacted every part of government. Goal number 1 is to reduce Kentucky's rate of uninsured individuals to less than 5%. And these are 5-year goals. More than 500,000 Kentuckians have signed up for health coverage through Kynect, and as the governor has said, we had the biggest drop in the uninsured rate in the country last year. The uninsured rate has plunged to 8.5%, as you can see in the chart, from a high of 20% before the reform. So we're well on our way to achieving the goal of ensuring that even our most vulnerable citizens have the benefit of affordable health care. Goal number 2 is to reduce Kentucky's smoking rate by 10%. Smoking is the number 1 preventable cause of death in the country, and this is an area where Kentucky has ranked 50th. We have now moved to 49th. But smoking by adults has dropped to 26.1% from a baseline of 26.5%, and smoking by youth has dropped to 16.9% today. Those are 2015 figures, compared to 17.9% at the start of the Kentucky Health Now initiative, a full percentage point. One significant factor in this regard has been Governor Beshear's executive order banning all tobacco use and products on executive branch property. A new report being issued with our report today from UK shows that since the governor banned tobacco use on all executive branch property, among employees of the executive branch, cigarette use is down 18%, smokeless tobacco down by 26%, and the use of e-cigarettes down by 23%. Additionally, there's been an increase in smoking cessation prescriptions for the executive branch employees who are enrolled in the employee's health plan. Goal number 3 is to reduce the obesity rate among Kentuckians by 10%. The percentage of Kentucky adults who are obese dropped from 31.6% in 2014 down from 33.6% the previous year. A recent report, the 2015 State of Obesity Report, released by the Robert Wood Johnson Foundation, shows Kentucky's adult obesity ranking decreased from 5th highest to 12th highest in the United States. Our youth obesity rate, however, showed an uptick, which is an indication of the importance of continuing our targeted efforts on this alarming health statistic. Goal number 4 is to reduce cancer deaths by 10%. And as most people in this room know, Kentucky has long had the highest mortality rate for cancer in America. But cancer rates are dropping and moving in the right direction. Cancer rates in Kentucky dropped to 201.2 people per 100,000 in 2012, down from 207.4 per 100,000 in 2010. Goal number 5, to reduce cardiovascular deaths by 10%, and we're moving in the right direction on that goal as well. Cardiovascular deaths in Kentucky dropped to 260.3 individuals per 100,000 in 2014, down from 271.7 per 100,000 in 2011. We have improved from 48th in the nation to 43rd. We're seeing an increase in the percentage of adults being treated for high blood pressure who receive cholesterol screenings and are enrolled in smoking cessation programs, which will continue to impact this trend in cardiovascular disease. Goal number 6 is to reduce the percentage of children with untreated dental decay by 25% and increase adult dental visits by 10%. Kentucky has seen an increase in the percentage of children ages 1 through 20 who have received dental services, from 48.3% of total eligible children receiving a dental service in 2013 to 49.5% in 2014. We've expanded the public health dental hygiene program, and since starting the program, approximately 3,600 patients have been seen and over 22,000 services provided. And we've created public-private partnerships to increase the proportion of students in grades 1 through 5 receiving twice-yearly dental fluoride varnish application. Goal number 7 is to reduce deaths from drug overdose by 25% and reduce by 25% the average number of poor mental health days in Kentuckians. This is an area where the data does not show progress yet. We stayed the same in poor mental health days, and we actually lost ground in deaths from drug overdose. But the passage of Senate Bill 192, the landmark heroin legislation, during the 2015 General Assembly session should make a significant difference going forward. And since passage of that legislation, several communities have successfully launched needle exchanges to combat the growing problem of drug overdose deaths and high rates of hepatitis C in Kentucky. It's important to note that the data here comes from different sources, and it is the latest data available in each category. For most categories, we don't have 2015 data yet, and we would expect all of this to be updated in the spring. In some cases, the data is from 2012 and 2013, so we don't even have 2014 when we had a full year of expansion under our belts. But if you'll remember, we went to managed care for Medicaid in 2011, and we expanded K-CHIP in 2011. So we were beginning to take the steps forward in improving the health of our people even before Medicaid expansion. So this is the latest data that we can compile at this point. While this report clearly shows we're making progress toward that new goals would need to be established at the end of those 5 years and illustrates the need to stay on course if we're going to continue to move these numbers. We are at a turning point in our battle to advance health in Kentucky. The evidence is overwhelming. We are finally moving the needle on some of Kentucky's most debilitating health problems. As someone who has followed public policy for decades, I know that historically one of Kentucky's challenges has been in failing to maintain a sustained commitment to long-term initiatives that tackle our most difficult problems. But on this issue, we simply cannot afford to go backward. This is a once-in-a-lifetime opportunity to change the future of Kentucky. We have demonstrated that improving the health of our people is affordable. It's time to move the discussion from saving money to saving lives. Thank you.
Any questions?
I know you met with Matt Devin earlier this week. How much of this did you communicate to him? How did that conversation go? What was his reaction?
Well, we had private conversations, and we both agreed not to go into the conversations that we had in detail, but I did highlight some issues that I wanted him to take a very hard look at, and this was one of the issues I highlighted. And I am encouraging this incoming administration to look at the data. Just look at the facts. Look at where we are today as opposed to where we are 2 or 3 years ago, and make decisions based on those facts and those figures, and most of all, make decisions based upon what's best for the people of this state.
He, of course, campaigned on dismantling Kynect and changing the way that the state does Medicare, and won in a landslide. How do you explain that?
Well, elections are won and lost on a whole lot of issues. Personality, a variety of issues, who turns out to vote. I think, answer your question in this way. I read in a national newspaper article an interview that the reporter had with a fella sitting in a clinic up in Pikeville getting health care. And she asked him who he voted for, and he said, I voted for Mr. Babbitt. And she said, well, don't you realize that he has advocated for you not being able to sit here in this clinic anymore and get health care? And he said, oh my goodness. He said, surely that won't happen. Now, that would destroy my life. So I don't think you can draw a direct line between who somebody votes for and some issue. There's just so much involved. Some people pay a lot of attention, others pay very little attention to politics, and that game's over now. One way or the other, the election's over, and Mr. Bevin won. He's going to be our new governor, and as I did mention to him, there's a big difference between campaigning and governing. I mean, this is a hard, difficult, complicated job, and there are so many things to balance. And I'm just urging him and his team, once he gets all of his team around him, to take a real hard look at the real world here in terms of health care for our people. I think it's incontrovertible that if you do that, then you realize that Kynect works, that I've got to come up with $23 to $25 million of general fund money and spend it to dismantle it when we could be spending it on something else, that it's not costing us anything right now, that it is getting people enrolled. So financially, it doesn't make much sense to do away with Kynect. And then for expanded Medicaid, the numbers speak for themselves. I mean, if they decide to roll back the expansion of Medicaid, yes, they'll save, $257 million. And they'll lose $500 and something million. So there would be a net loss in that budget of $300 million if they roll back Medicaid. Now, I prefer to look at this in terms of what it does for the lives of our people. But obviously, you also need to make sure you can afford it. Well, these numbers show that not only can we afford it, it would be stupid financially to turn your backs on it because it will lose us money.
Governor, you're going to depend on the Democrats in the House to carry all the water for this, and as part of this, what you call the service. If you call it Kynect, they're for it. You label it Obamacare, they're against it.
So let's call it Kynect. Look, there's a session coming up. It's a budget session. It's always the most important session in a governor's 2 years because of the budget. And I fully expect a vigorous debate about these issues. But in the end, I know that those legislators are going to have to balance that budget. And I don't think they're going to want to look at a $300 million hole in that budget, which will occur if you roll back the expansion of Medicaid. I really don't think they're going to want to try to come up with 23 million additional general fund dollars to pay to dismantle Kynect when it works right now. It's not costing us anything. So why do we want to pay $23 million that we could be spending on education or the pension problem? So hopefully that kind of thinking based on data and on facts will prevail. We'll see.
Governor, did Matt Bevin give you any sense that he's willing to reconsider or take a look at this? What can you say about your impression of your discussion with him on that point?
My impression is that he's willing to look at the data and look at the facts, and you know, he made no promises one way or the other, but he's a business guy, and he's used to looking at facts and figures and data, and so that's what I'd encourage him to do. Look at this from a business standpoint, if not from a human standpoint, and I'm sure that he'll look at it from both angles.
Governor-elect Bevin has said that he would apply for waivers from CMS for the expansion of Medicaid, similar to a program that Indiana has done. What issues do you have with that?
There's all kinds of potential waivers that one can apply for, but the bottom line is it's still going to cost us the same thing. One way or the other, whether you try to get a waiver to do something that maybe Indiana has done or maybe Arkansas has done, the bottom line is it's still going to cost about the same general fund dollars to have expanded Medicaid. But as we've shown, we can afford to do that. So the idea of going after waivers, I don't think is going to make a lot of difference in terms of the actual cost of the program.
Governor, do the new Medicaid recipients need to have some, quote, as Bevin puts it, skin in the game, as in paying some co-pays for some of these services, so that you don't get an overutilization of services?
Well, first of all, there are all sorts of approaches out there that people debate and talk about. You can certainly debate whether those that can afford it should have to put a little something in, and that gives them more respect and makes them feel better, and they take more ownership in it. You can also look at it as, you know, people are usually well most of the time. And if I'm only making $30,000 a year and I'm supporting a family of 4 and everybody's well right now, and I can take $30 a month or $50 a month that I would have to pay in order to be covered here and use it to feed my family or buy the textbooks that our kids need to go to school, people are tempted to say, well, I really don't need this health care right now. I need this money to support my family. So I think there are pros and cons of that kind of idea. And, you know, you can look at it. But either way, in the end, the program's going to cost about the same it costs right now.
Have you talked to the incoming Attorney General about potential legal strategies if this if it connects?
We're going to have a great Attorney General, I can tell you that.
Is there any other
No, I haven't talked to him.
any other questions on this press conference?
Governor, given that we're making such a public defense and explanation of the programs here today, is it reasonable to assume that you weren't confident coming out of the meeting with Governor-elect Bevin that he's going to see these figures the way you do? After all, most of these data were available during the election, and he routinely referred to them as baloney.
Well, the process that's coming up in writing a budget is a process between the governor and the legislature. And the reason we are here today is that I want them to know, and I want the world to know, what the numbers and the data are. And this is what they are, so that there can be no argument about where the money is, where it's not, what can be paid for, and what can't be paid for. I mean, here it is. This is it. This is the story that is supported by data and facts. Now, we've got to see whether that group together will be willing to look at the future of this state and the health of our people in terms of we can't afford to do this and this is good for them, or whether political ideology in some way or another is going to overshadow all of that to the detriment of our people. I'm very hopeful that in the coming months, with that debate going on, that there's going to be a realization here that political rhetoric's one thing, but the health of our people is another. And if we can afford to do this, it is crazy not to do it.
I wanted to ask, Matt Bevin has said repeatedly that there are too many people in Kentucky on Medicaid, and I'm wondering if you agree, and what does that mean to say Kentucky has too many people on Medicaid?
Well, certainly the more people make, the less people are eligible for Medicaid. And while we are trying to deal with the circumstance we have right now, and that is the status of our people under their current circumstances, we do have a lot of people on Medicaid. But at the same time that we are getting them better health coverage and hopefully getting them into a better state of health, we're continuing to create jobs that these people can get, better paying jobs. And folks, if you're healthy, you're a lot more able to take a job, make a living, and really come off of Medicaid because you're going to make too much. If you're not healthy, if you don't have access to affordable health care, you tend to be sicker, you're going to be off from work, you're not going to be productive, and you're not going to be a part of the workforce. So all of this goes together. This is a big picture thing that all of this comes together to help move this state forward. A healthier population is a more productive workforce, and they will be better able to work and earn a living and actually earn their way off of this kind of program. And then they'll be able to go to the health benefits exchange and buy a qualified health plan.
Do you want me to acknowledge the cabinet, or you want to do it? Audrey and Dr. Mayfield.
Before we end this session, I want to have a special thanks for some folks that really have stepped up and made this happen. We've got Secretary Audrey Tays Haynes. We've got the Executive Director of Kynect, Carrie Banahan. We've got the Commissioner of Public Health, Dr. Stephanie Mayfield. I wish we'd give all of them a round of applause. Here's two of them here. We would not be where we are today in delivering health services to our people without these folks. Anybody else? Thank you very much.